Turn now to another problem that's got a little attention, but is a real one. Multisystem inflammatory syndrome in children. We know that COVID has historically affected older Ohioans more than children, but children certainly are not immune to getting sick with COVID. In some rare cases, they can develop what is called multisystem inflammatory syndrome. They can have serious complications for children. They can certainly become very, very sick. Today I've asked Dr. Dustin Fleck, the chief rheumatology at Dayton Children's Hospital in Dayton, to talk to us about this syndrome. Doctor, thank you for joining us, and just tell us what this is, how it manifests itself, and what parents should be looking for.
All right, thank you, Governor, for the introduction and having me here today. MISC, also known as multisystem inflammatory syndrome in children. What this is a post-infectious inflammatory syndrome that's generally associated with COVID-19 infection. What makes this unique versus what's a lot of the talk with the COVID infection right now is it's not actually associated with an active COVID infection. This is a kind of a post-infectious inflammatory response that usually develops about 2 to 4 weeks after kids can develop either a symptomatic or asymptomatic COVID infection. The simplest way to put it is it's just an abnormal immune response, usually characterized by fever, significant inflammation throughout the body, specifically targeting the heart, but can also involve the GI system, liver, lungs, kidneys, as well as brain. From a little bit more complex standpoint, we've been using a lot of analogies with MISC with a common disease that we've had around for a while known as Kawasaki's disease, which also has some similar symptoms. What we do notice with MISC, it does seem to be more severe, more resistant to therapy, and kids are more likely to develop heart manifestations and long-term problems associated with MISC versus Kawasaki's. Other variants and presentations that we kind of see with MISC, some kids develop kind of abnormal kind of activation of immune cells, which can start to invade the bone marrow, the liver, as well as spleen. This can be seen in about 25% of kids, and this is a condition known as macrophage activation syndrome. It does require some different therapies to kind of help reduce that inflammation.
Doctor, let me interrupt you because I kind of lost what you said. You said 25% of what?
25% of kids with MISC or this can go on to develop this extra immune activation that can require some different therapies to kind of help. MISC, all the different kinds of presentations that we can see have a really high risk of developing some inflammation of both the heart muscle as well as the arteries and blood vessels that supply blood to the heart.
What should parents look for?
The biggest thing that people should look for, the vast majority, near 100% of cases have fever as well as some kind of GI symptom. We see abdominal pain, vomiting, diarrhea that can be associated with it. Other symptoms kids may have may include rash. They may have swelling in the hands and feet. You may notice some redness of the eyes, some redness of the tongue, some dried, cracked lips. Overall, kids just may feel ill. They may be weak, lethargic. Symptoms alone aren't enough to establish a diagnosis. So if some kids are having symptoms similar to these, being evaluated by a primary care doctor or elsewhere to kind of get to the bottom of the symptoms should be done.
And doctor, you talked about this coming on later. How much later? Someone, let's say I have a child that comes down with this and diagnosed with COVID. When would I start looking for this to see if this is occurring, or what's the normal progression if that happens?
Normally it occurs about 2 to 4 weeks after exposure. We've been seeing on average about 4 weeks. Now that doesn't include, kids don't have to have active infection. We've had a lot of kids who have quarantined due to exposure but didn't go on to develop any symptoms of any active COVID infection, but then went on to develop MISC approximately 4 weeks after, and they had antibodies in the bloodstream demonstrating exposure to it before in the past.
Dr. Fleck, if I could just ask one quick question. Do we have any better understanding of why in the US more Black and Latino children have been diagnosed with MISC?
We don't. There's been a lot of look into this, and we're trying to extrapolate kind of studies from Kawasaki's disease, which kind of generally affects more of the Asian population. We think there's a lot of genes and genomic factors that play a part into this. Makeups of immune system and genetic factors may make people more predisposed to this. But with Kawasaki's disease, which has been around and kind of noticed since like the 50s and 60s, we still don't have a clear understanding of that. But I know a lot of people are working hard on research to kind of figure out what makes kids more prone to develop this syndrome.
And doctor, roughly how many have you seen at Children's in Dayton?
We've seen approximately 35 cases since the beginning of the pandemic, dating all the way back until April.
Without a vaccine, obviously available for younger children yet, again, recommendations to parents as far as how they proceed?
Yeah, so, at this time, until vaccination becomes, available for children, although the risk of MISC is still low, it's still present. And, although kids may not have symptoms of COVID-19 infection, they can still go on to develop this. So it's still going to be dependent on appropriate social distancing protocols, mask wearing, and adults getting their vaccinations to help prevent spread, which will help prevent exposing kids and will hopefully decrease the risk of these cases going forward.
Great. Dr. Vanderhoff, any other questions?
No, the only thing I might add, Governor, is that here in Ohio, since the beginning of the pandemic, we've had a total of 166 children treated for this case.
Okay. Doctor, thank you very much. We appreciate it. Thanks for being with us.